This is Bill Crowther. He's 57, just collapsed in the school playground. Suspected MI. Pulse is 110, BP 170 over 90. Crushing pain down his left arm, breathless, nauseous, on no other medication.
Was he given anything in the field?
I'm sorry about the ambulance. It was the school that called us.
Don't you worry about that. I'm Dr. Christine Fletcher.
Oh.
Now, it's important that you try to stay calm. Can you give us a hand just moving over to the other bed?
Here we go.
Just as much as you can, Bill. Gently, gently.
There you go.
Okay.
Is it a heart attack?
I can't be sure till I clarify a few things. Have you had problems before?
No. Can I ring my wife?
We can take care of that.
Can you tell her not to worry? She's such a terrible fusspot.
Is she? We'll do a 12-lead ECG.
Okay. Now, you take care of yourself now, Bill. You do know your phones are down, don't you?
Yes, I do. I'm dealing with it.
Angelo, can I talk to you about the phones?
No, not me.
Jack wants you to see Mr. Hume this morning.
Who?
Drugs rep.
When?
Oh, and he also wants to know, quote, why you lazy bastards downstairs don't answer your phones.
It's bad news, I'm afraid. Your whole system's died.
We need phones as quickly as possible, please.
Ah, the glamour of power. Jack, hard taskmaster. Delegate, secret of good management.
Is that an offer of help, Robert?
On my department, I'm strictly hands-off.
Of what exactly?
Anything without a pulse.
The new rotor, Chris?
Not yet. Oh, just the man. There's an MI in recess. Can you deal with it?
Sure.
Judy's with him. She's doing a 12 lead. Thank you.
Okay.
Well, looks as if you were right. You had a heart attack.
Am I going to have an operation?
I shouldn't think so, no.
My dad had one.
We'll give you some medicine. It's a lot safer.
Oh.
Yep, that's better.
I'll look after myself. The wife sees to that. It's all brown bread and rabbit food.
And you've never felt anything before?
Well, I sometimes get these pains.
Did you see a GP?
No. Well, I don't really have the time, what with the wife and work.
Well, tell her. You need to slow down.
Your wife's on her way. She'll be here shortly.
We'll start Bill off on 50 milligrams TPA, Judy, all right?
Okay. Oh, and the school rang, Mr. Popular. All the children are asking after you.
Where'd you work?
Kirardi Primary.
No. I went there. I used to give a caretaker nightmares.
You've done well for yourself, then. Like our Craig. He's very high up in computers.
Budget holder. Is that a real title?
Well, the work's real enough. You do it anyway.
Okay. Why not?
Fine. The A&E purse is all yours. Don't spend it all at once. Well, Andrew Argyle, we're not getting our money's worth out of him. I'm bringing back to A&E full-time. Andrew.
I'll see you later, mate.
No, right on time. Just explain to Christine the arrangement. But you two have worked together before, haven't you?
Yeah. It'll be great to have him back on board.
Christine, give me a quick word.
It'll have to be quick.
You're okay about this change?
Why shouldn't I be?
No reason. Just given our, history.
Have you said anything to Jack about that?
Of course not.
I'd like to keep it that way. How's he been behaving?
Good as gold.
Did you need to sit down?
You're the one who's supposed to be taking it easy, remember?
Chris, there's a Mr. Hume to see you in reception.
You have to wait. No rest for the wicked, eh? I'll see you later.
You didn't happen to see my wife out there as well, did you?
Sorry, not yet.
You'll be starting him on streptokinase.
TPA.
He's 57.
Robert used TPA.
You don't get TPA unless you're under 50. We're sticking to hospital guidelines now.
Why now?
You've seen Jack's directive. We're not making up our own rules anymore. Okay?
Okay. Strep it is. Hang on, Judy. Change of plan. I'm going to start Bill off on 1.5 mega units of streptokinase in 100 mils of saline. Orders from on high.
Okay.
Yeah, it's dead painful. Goes completely when I run sometimes.
Do you play football?
Oh, yeah, loads.
And do you think you can run any more than, say, 3 yards?
Yeah, easy.
Why don't you run back over there and see if you can fix the friggin' phones, eh?
Excuse me.
I've just told him about the knee, right? And all
I'm looking for my husband, Bill Crowther.
doctor or nurse.
He's had a heart attack.
You want a medical opinion, mate? You queue up like everybody else.
Let's have a look at the board, shall we?
All right, don't get a cob on, pal.
Listen, let's all get back to work, shall we? I'd like to say it's not always like this, but...
I got here as quickly as I could. He must be worried sick. He thinks he has to do everything.
Your husband's in resource with Dr. Phelan. Dr. Phelan?
Yeah.
This is Mrs. Crowther. She'd like to talk to her husband. I'll leave this to you.
He's going to be relieved to see you.
Is he going to be all right?
Why don't we go through and I'll tell you what's
He
happening.
wouldn't tell me anything on the phone.
No, when we get through here, we can fill you in.
Jude,
Hey, hang on a minute, sorry. This way.
are you looking after the MI in resource?
Bill Crowther? Yeah?
Okay. That's his wife. Keep an eye on her. It's bound to make her Parkinson's worse.
Okay.
And what else are we going to need?
Hey, a special drill?
Christine, get onto that.
All right, catch you later.
I'm in a bit of a rush.
I've been trying to get you. I've been calling.
No phones.
Ah, lunch?
I don't have lunch. I'm too busy. Give me a ring.
Right. No phones.
I'm going to be fine. Aren't I?
Yeah, he's doing very well.
You don't look like my Bill. How are we going to manage?
I'll give up the job. We've got some savings.
We'll lose the house.
Get better. I will. I'll get better.
Come on, you two. This is not helping.
Keep telling you to stop worrying.
No, Bill, it's you that's got to stop worrying. It's bad for you.
The doctor's right. It's my turn to look after you now. Let's phone Craig.
No, Margaret.
I think he'd want to know.
We'll call him once I've got home.
You'd want to know if your dad was poorly.
I could ask one of the nurses.
No. Thank you, anyway.
This is Anna James, upper airway obstruction. She's 22, been feeling unwell for a few days. Fever, sore throat.
Anna, can you tell me what happened? Can you squeeze my finger?
We've tried to tube her, but her tongue's too swollen. We couldn't get it in.
How about a cry?
No, we should fibre optic first.
Okay, do it. Any medication?
On my counts, 1, 2, 3.
We don't think so. Saturation 92% on 8 litres. BP's 100/40. Pulse 140. She got a litre of saline in the field.
Any idea what's caused this?
None.
Has she got any allergies? Been anywhere exotic?
No, I don't think so.
Taking anything, any drugs?
No, we've been at home. We thought she had flu. Is she going to be okay?
Terry, BP?
50 over nothing. Can't say a bloody thing.
Come on, waste some time here. We're going to do a cry.
Yeah, you're right. Excuse me. All right, that's in.
Stuart, can you lend a hand, please? Get a central line in. Kathy, could run through a litre of Hartman's.
Done.
Don't worry about my pills.
I just want you to set my mind at rest. Have you brought it off? Margaret?
When they rang, I just grabbed my bag and came straight here. Don't worry about me, Bill. Bill? Bill? Bill?
Don't worry, Margaret.
But you have to go outside and then ring through main switchboard.
I could walk to CCU quicker than that.
Robert, it's Bill. BP's 80/50. His breathing's laboured and his throwing. I'll pick right, left and centre.
Okay, let's do another 12, leave.
Okay.
He's extended his info.
Yep.
What? Well, why was he giving... Give me 50 milligrams of TPA now.
Good.
It's all right, Bill. Everything's going to be all right.
No, we're going to try another drug to unblock the artery. You just relax, okay? How you doing, Margaret?
How's he doing?
He's doing fine. Jude? Why was he given strep, not TPA?
Hang on, Rob.
Young patient, anterior infarct, recent onset. You know it should have been TPA.
You need to speak to Christine. It's her call. Hospital guidelines are paramount.
have a word.
See you next week. Thanks again.
What the hell are you playing at penny pigeon with my patients? Giving Bill Crowther streptokinase instead of TPA.
It was the appropriate drug.
It was the cheapest drug. Right in a lot of cases, not this one.
There are guidelines, Robert. We've all got to follow them.
Bollocks to the guidelines. It's not how I run my department.
You don't... Resources are limited. Jack's guidelines make sense. It's fair for everybody.
What were you thinking of?
It was a difficult call.
Yeah, well, then you should have talked to me.
Why? I had made a decision.
You made a wrong one. Do you want us to call anyone for you?
It's our son, Craig.
Do you want me to ring him?
Bill doesn't want him to know.
Bill's very ill, you know.
Craig's our only one.
I think your son should know.
I don't want to upset him.
And he wouldn't want you to deal with this on your own, would he?
We've not seen Craig for a while.
Make the call, Margaret.
I'm not normally this bad.
You've been under a lot of strain. Come on, I'll dial for you.
BP's still falling, mate. Shit. She could go into multi-organ failure. Her kidneys could shut down.
I'm sorting out an arterial line here.
Is she gonna die?
What's the temperature?
It's going through the roof.
It's got to be septic shock.
From what?
Her tongue shouldn't be like that. Ah, hang on. Think I've got it.
Got a stud in it.
Gotta get it out.
Buzz?
Yeah, but she's severely acidotic.
Yeah, tericrystalloids and inotropes. Stuart, can you sort me out with the catheter?
Yeah.
This is the best I can do. It's not sterile.
It's the least of her problems. Here.
Cheers, Terry.
Is she gonna be all right?
She's out of immediate danger.
What was wrong with her?
Well, you'd know it as toxic shock syndrome. I think an infection in her tongue stud caused it. Basically, toxins have got into Anna's bloodstream.
And you've got rid of them?
No, a course of strong antibiotics will do that. But the stud's out now. I think she should be fine.
Will you be looking after her?
Not me personally, no.
I'll be taking her up to intensive care. And then I can take you girls to the relatives' room.
No, you're okay, Raz. I'll take them.
No, I think Kathy should take them. Kathy, would you? See you later.
Thanks so much.
Bye.
Well, seem like nice girls.
In your dreams.
The control. With more are important for the team.
The brigade were showered with bricks and stones as they dealt with an incident at around 7 p.m. They said
You catching flies?
they took 2 engines.
I better get back.
There was a hail of missiles. Police were called and a youth was arrested.
Kim Taylor, please.
You must be really ill to get seen so quickly.
Just through here. I just want something for the pain.
See what's wrong.
Well, there are a few formalities that we need to sort out first.
Just a pill or something.
Please take a seat. So, where exactly is the pain?
Oh, I see. Where have you been?
Been in resus.
So the rumour's true they do work in there. Well, I needed you upstairs.
Note to self. Must learn to bilocate.
Christine, making her presence felt, is she?
No, I wouldn't say that. Robert's got it in further.
Oh. Trouble in paradise?
How'd you fancy one of them in your tongue, mate?
Nope. There are worse places, lads.
Oh, come on, you old farts. Piercing's trendy.
It's daft.
Well, they're young people. They do daft things. You did, didn't you?
I got married.
I mean, you were both medical students, weren't you? Never knowingly sober.
No, I was a boring bastard by then.
You still are, mate. In fact, both of you are boring bastards.
How are you? He is going to get better. We're doing everything we can. Strep didn't work then.
CPA's still mine.
Mm-hmm.
Was it the right call?
At this hospital it was. You have to draw the line somewhere, Stuart.
Here you go, hotshot. Severe lower abdominal pain. Wants an instant cure.
Can I help you, girls?
Hiya.
Hello.
Just thought we ought to come and say goodbye.
How's your friend?
Oh, they told us that she'll be for a few weeks, but she's out of danger.
Thanks to you.
Thanks.
Well, that's really good news, but I've got to get on, so...
Oh, yeah. Sorry, I know you're busy, but, we want you to...
Have these. As a little thank you.
Oh, thank you very much. That's very kind of you. Thank you. Bye.
Bye.
All right.
So what are they? Freebies for the new bar. Too cool for you lot. Come on, hand them over.
Hang on. We've earned them. Get lost.
Are you going out then?
I might do.
We don't know what that means.
Yeah. Mike's going out for this pizza, not having it delivered.
Sorry, Kate.
Right.
Sorry.
Michael, what are you doing here?
Paul Hardy.
Got the wrong person now. I'm over here.
And just relax. Would you be more comfortable seeing a female doctor?
No. It's not that. It's just... Oh, I didn't think... Look, I'm in a real rush. I'm getting married. I'm meant to be moving abroad in a month.
Well, it may be nothing, but I can't tell until I've had a look. So, please? Could you be pregnant?
No,
Ectopic pregnancies can be very dangerous.
definitely not.
Well, I'll run a test anyway.
Craig.
Mom?
How are you doing, Dad? You needn't have come. But as you're here, just make sure you look after your mother.
Your dad's still the same, you see. Still fussing over me. Aren't you, love?
Would you like to speak to Dr. Fillon? He can fill you in.
Yeah. I'd like to speak to his consultant.
Okay, that's Mr. Kingsford.
Oh, bollocks.
How good looking at me, boss?
Kathy, could you help me get an ultrasound done, please?
With or without a radiologist?
Do you want an update?
No, unless you've got them working.
Excuse me, I'm looking for Mr. Kingsford's office.
Straight through there.
Got the results back for Kim Taylor. She's not pregnant.
Could you help me get a scan done?
Well, I'll run up to radiology for you, if you hand over those tickets.
Maybe I should give her a shot. Kim. Come on.
I'll get something for the pain.
Great. Kim, you're going to have to let me help you. Kathy, scan, please.
Come in.
Sit down. Oh, no, thanks. Just want to know how long you're going to keep him in here.
All right, let me take you through it step by step.
Oh, come on, you must have some idea. Week, month, couple of days?
Well, it's not as straightforward as that. Whatever happens, he will need a lot of rest and a complete change of lifestyle.
Is he going to have to give up his job?
That's a possibility, yes. They're both going to need a lot of help.
Look, if he loses his job, then they'll lose the house. And, well, they can't come and live with me.
Excuse me, would you like to come with me, please? Why are you here?
It's my knee again.
What happened to last night's prescription?
I lost it.
So what's with the new name?
Well, what's with your new job? You must have been working 24 hours straight. Well, maybe I'm confused. What is it? Amnesia or moonlighting?
I only work here.
No, you don't. You treated me last night at the Mountfield. Must be amnesia. You should see a doctor.
You are not going to get any more drugs here, so I suggest you leave now.
Just remember, if I get chucked out, you're coming with me. I don't think it's another hemothrosis. It's just I've had so many in the past.
Which unit do you normally attend?
Oh, London. I'm up here seeing friends.
You've been better off going to City General, you know. We've got a haemophilia unit.
Well, I don't think it matters. All I really want is some painkillers. DF118 normally does the trick. I'll be back in London by the weekend.
Yeah, shouldn't be a problem. Okay.
They said I might have to have the whole knee replaced.
Yeah, I thought you had to be a bit older.
Yeah, in the future.
Right, well, I'll have a look for the medication. There might be something better around.
Oh, DF118 will do.
Okay, just be a minute.
Margaret? How's Bill?
Craig's still with him. I wondered if I could ask your help.
Yeah, sure.
I've forgotten my pills. They're called... Well, I can't...
Is it methyl dopa? Yes, sorry, don't worry, we'll sort that out. How's Craig bearing up?
He's putting a brave face on it. Finds it hard to show us. Bill and I, we try not to burden him with our problems.
You're not a burden, you're his mother.
Since I've been like this, I think Craig's found it hard.
Of course he has, but he needs to face facts. You're going to need help. Listen, don't worry about that. We'll sort it out. You go back to Bill, and I'll bring your medication in for you.
I think there's a problem here, and I think we maybe need to re-examine because I think he's a con man.
I've never had this hassle before.
Do you mind waiting in here for a moment? Can we, What's going on?
Kate's making allegations about my patient.
Kate?
I thought I knew him, but I'm not sure.
Everything sorted?
Yeah, sure. Do you mind waiting inside for a minute?
Look, this is beginning to really piss me off. I don't get this problem at other hospitals, do I?
Inside the cubicle, please.
Pleased to see I'm not totally obsolete.
I'm sorry?
After this month's cutbacks, I thought radiographers might be going out of fashion.
Don't flatter yourself, he's only after his scanner.
Your expertise is welcome anywhere. Tubes and ovaries, please.
Don't worry, I'll give you the best shot. Right. Still feel a bit cold, okay? Just try and relax. Come on, Kim, help me out here. My job's on the line.
Well, what can you see?
Nothing at the moment, because you keep moving.
Kim, just forget about what she's doing and try and relax.
There's something wrong with this. Can I have a word?
Is your idea of a joke?
I'm sorry?
Looking for ovaries in a man.
What?
Your patient? She's a man.
Don't be ridiculous.
Look, I know my job. That's definitely a man.
Oh, it's an easy mistake to make. I mean, we've all done it, haven't we, guys?
Yeah, absolutely.
I had the same trouble with the budgie man.
Well, that doesn't make any sense. Stuart, you saw her.
Yeah, I didn't examine her.
Yeah, but she looked really good. How did I miss that?
Here's a hint, Mike. Did she stand up when she gave a urine sample?
Well, anatomy was never my strong point.
Come on, Kate, help me out here. Are you scared? Is he bullying you? You look shattered.
He's after painkillers. He's a junkie and he's using a false name here. I treated him last night at another hospital.
Another hospital. Are you moonlighting?
I need the money.
Are you in trouble?
I just broke.
Shit. You know you're throwing away a career here.
Oh, look, I know it's wrong, but I mean, you must have done it sometimes. Everyone has, haven't they?
Yeah, we've all done it. But times change. And they've changed for a reason.
Are you going to sack me?
If you carry on moonlighting, I've got no choice.
Robert, resize Bill Crowther.
Get Chris. Okay. Get out there, get rid of that parasite and start giving me 100%.
Pressure 60 on nothing, pulse 120.
I'm going to do a neckline.
Okay.
What rhythm we got?
He's having runs of VT.
Yeah, give me a loading dose of amiodarone.
I'm on it.
As you can, Terry. You got? Yep.
Sat's 85% falling. It's in VF.
Joules? Yes.
Clear.
Again.
360.
Yes.
Clear. 360. Clear.
We got him.
BP's still falling.
Okay, let's get some dobutamine into him.
Another 12 lead.
Get cardiology down here, son. Oh, shit. Do you want me to run up there? No, I'll do it.
We would have found out eventually. No one would have thought anything of it. We're pretty unshockable here.
But that's just it. I don't want to be shocking. I want to be normal.
Kim, it's only appendicitis. You'll be up and running in 3 weeks.
You don't get it, do you? I'm meant to have my last sex change operation next week.
Well, it can be postponed.
It doesn't work like that.
I'll call your surgeon.
I'd have to wait another 6 months. I can't wait that long. Until it's done, the law doesn't see me as a woman. You don't. Do you? I'm terrified that someone's going to find me out. My neighbour, my boss. After the operation, we're meant to move to France.
Well, you can still do that, can't you?
It's been planned for years. The wedding, our new home, a new start. Finally, I was going to be what I always felt I was. A woman.
I'm sure your partner would understand.
Yeah. Of course.
course you would.
Kim, you've done really well. Look at you. Look how far you've come. Look how strong you are. I would have crumbled under the weight of all this. After what you've been through. And again, I'm just a feeble, self-absorbed bloke.
And there's no operation for that, is there?
What are you looking for? Out, now! You've got nothing on me. If you don't leave now, I will call security.
Sod off.
Help! I need help!
Stop! You're right.
Yeah.
You lying little shit.
Don't worry about it. It was very convincing.
Up until he arrested, the 12 lead showed anterior septal ST changes.
What about the enzymes?
CK sky high.
What was he given?
Initially streptokinase.
What?
It's 57.
You have a budget too. You said TPA now, right?
Yep.
What's his age got to do with it? I want to know what's going on.
So I'll tell you later.
I want to know what you meant earlier about his age.
Yeah, look, sit down. Look, age is a factor in any patient's treatment.
And so is money.
Oh, yeah.
I heard you.
That's right. Hospitals have budgets. There's a finite limit to our resources, just like anybody else's.
And you saved some money on my dad.
Your father was given the appropriate drug.
Appropriate? Appropriate for what? Your budget or his health?
For his age.
And how old are you?
Well, my age is irrelevant.
Yeah. And I bet you wouldn't have been given the appropriate drug. You would have got the best one.
No, there is absolutely no way for us to tell whether the more expensive drug is the more effective drug.
Oh, just because he's a caretaker, you think you can take advantage of him? Well, I'm here now, and I'm going to make sure he gets the...
What am I going to do?
I'm here, Mum.
Okay, let's go.
Oh.
Now, don't worry, the scar will be tiny.
So it won't even show when I'm wearing my thong. Thanks.
No worries.
Hi. Well, you've perked up. So there is life after Kathy then.
Mike. Terry. After football injury. Yeah. Put him on hold.
See on here.
Until they fix the phones.
Through the top, right.
I want to sort this out. Bill Crowther is getting the best care this hospital can give.
Bullshit. He was shortchanged and you know it.
It wasn't an arbitrary decision. There's medical evidence to say streptokinase is a better drug for older patients.
Your decision was based on money, not medicine. He's 57. He has a dependent wife. She has Parkinson's.
Please don't bring the wife into this. Would we be having this argument if the patient was single and without dependents?
Do you honestly believe that? After all I've taught you?
That's what this boils down to. Your star pupil not doing what she's told. You know, I spend half my week in this office doing paperwork while you're out there having fun with the patients.
Ooh, interrupting anything?
I was just leaving.
Date for your diary.
Can it wait?
First budget meeting.
I've got to go.
Too many patients, not enough money.
Yeah, difficult job. I mean, she really shouldn't get quite so involved, though, should she?
Did I put my foot in it earlier?
No, it wasn't you. It's been a difficult day.
Robert?
A difference of opinion. I made the right decision, it just didn't work out.
Well, hindsight's 20/20.
You still feel guilty, though.
Part of the job. Bound to be, unless you're completely inhuman.
Doesn't get any easier.
It's just a question of learning to let it go, I guess. I'd better press on, but, drink later?
That'd be nice.
Well, I get finished about 8.
Okay.
Good.
Excuse me, madam. Sorry, Mike. Easy mistake.
Very funny. Right then, new bar. Who's up for it?
Yeah.
Sorry, Sam, boys night only. 3 tickets. How about Andrew Argyle?
We need someone to make us look good.
You're not actually going, are you? It's probably a tranny horn knowing you a lot.
I'll give him a call. Ah, the boys out on the town. Yeah. Hi, Robert. See you, Ross. Oh, looking good.
I'd have you.
Come on, you two. We want to get the best seats at the bar.
Cheers. Look, I went too far earlier. I was just so angry.
You're right to expect proper treatment.
They wind me up. They always have. I feel like I'm 5 years old. It's pathetic. And she's so spineless.
Mother's very ill, especially today.
It's not just now. He makes a decision and we're all supposed to jump. Your dad knows best. Leave it to your dad. You know how long it took them to tell me she had Parkinson's? 2 years. 2 years. We didn't want to bother you, that's what she said. I'm amazed they even rang me today.
Well, it's natural for parents to try and protect their children.
He's not going to get better, is he?
He's very ill, that's for sure. He's probably been experiencing symptoms for some time.
Well, that's just what I mean. They shut me out all the time. They've got each other and that's all they need.
Are you sure?
I won an award last year. It was a big do. Sit-down dinner. I really wanted them there. You know, make them proud, share it with me. I never turned up. 2 empty seats there were.
Did you ask them why? They might have had their own good reasons.
Oh, yeah, they did. Said they'd show me up. They'd feel out of place. What about me, eh? What about how I felt?
Well, today's different. Relationships change. There comes a time when you have to start trying to understand them, instead of always expecting them to understand you.
You haven't got a clue what I'm talking about, have you?
He's a little better, but he's still very poorly.
Can I see him?
Of course.
Well, you go, Mum. You'll want to see him on your own.
Go and see your dad.
I'm just not sure whether... I don't know, whether staying on at St. Vic's was wise.
Where's that?
Too much history.
Well, I'd miss you if you went.
And why's that, Jack?
Very good to have around.
You're really living up to your reputation.
Reputation? What reputation, sir?
Does this actually work with other women?
Absolutely no idea what you're talking about.
Your table's ready?
Oh, jolly good.
Did I miss something?
We're going to eat. Doctors eat. They do.
Yeah, they do.
Time to all get going, mate.
Give it 2 or 3 hours and it'll be heaving.
I'm off.
I can shift at 7.
No, I'm going to hang on here.
No staying power.
All right, new app. Well, we can put that to good use. Come on.
See, the Chateaubriand is very good, but that's for 2, of course.
I wonder how often that's been said in this room.
Oh, that's unkind. We're here strictly professionally, aren't we?
I'm sorry, I was distracted by the surroundings.
Well, not intended.
Of course not. We're here to talk shop.
Yes. Yep. Yep. Yeah, so, do you think our 2 departments should have a closer relationship?
It could be risky.
Could be, could be. Could be interesting.
How would it work?
Well, it would obviously have to be dealt with very sensitively.
And you're the man for the job. Our department's very different. A&E tries to stabilise. Trauma's there for a quick fix.
No. I'd want more, wouldn't you? I mean, I think we both would, wouldn't we?
Are you ready to order?
I know what I want. I think we both want the same thing.
Hello, this is Christine Fletcher. I'm sorry I'm not here, but please leave a message and I'll get back to you as soon as I can.